In 1918, a world recovering from the terrible effects of what was then called the Great War was hit by another tragedy. A new strain of influenza H1N1 swept across the globe. Over 25 million people died, with over 15 million victims in India alone. The first recorded outbreak of this new flu was at Camp Funston in Kansas, USA, when soldiers from Haskell County, 300 miles to the west, brought the disease into camp when they arrived. The outbreak of a new and virulent influenza was reported by a Haskell County doctor in February 1918. The county newspaper, the Santa Fe Monitor, reported many people were ill with pneumonia and dying. They also said young men from the sparsely populated county were reporting to Camp Funston. From the camp, the flu spread quickly across the country, and soldiers carried the disease to Europe, where it soon infected the general population and soldiers alike. Despite being thousands of miles away from the epicentre of the pandemic, New Zealand was not spared. The first cases were recorded in Auckland in early October. Many New Zealanders believed that the Niagara, a returning troop ship which also carried Prime Minister William Massey, was responsible for introducing the pandemic, but it is now thought certain that previously returning soldiers had already introduced the disease. The first recorded cases in Wairarapa occurred at the Featherston military training camp. In early November, it was reported 299 men had been hospitalised. By the end of the month, over 2,000 men were being treated and 22 had already died. Ivan Gray was called on to help.
It was right at the end of the war, and the soldiers in camp, in Taranaka camp, I had to take at least 2 loads of coffins down. They were dying like flies there.
The first Masterton deaths were reported in the newspapers of November the 13th. Wairarapa citizens had gathered in the streets to celebrate the end of World War I, little realising that some of them were already infected with the disease. Some of the crowd collapsed at ceremonies held in Masterton Park and were rushed to Masterton Hospital. As the disease spread through the community, the government issued guidelines to control it. Those infected were to be kept in strict isolation, and all material used to treat patients had to be burned. Those treating patients were told to be very careful with their own hygiene and to gargle daily with disinfectant. Inhalation chambers were established in most sizable towns, and citizens were encouraged to visit them daily. Marjorie Tully recalls the chambers.
They had a room, all not half the size of this, where they had formalin sprays or vapour or whatever it was, and you went in there and breathed it for, I don't know how long we stayed there, but Mother made us go down, and I remember inhaling this stuff, and it was awful. It made you cough and splutter.
People were also encouraged to disinfect their houses. Others, such as Doreen Jameson's father, tried other methods.
My father was the only man on the railway here who didn't get it, and do you know what he did? He kept a small bottle of eucalyptus, and he continually put that under his nose. He didn't seem to mind it. And he attributed his being the only one on the railway who didn't get the flu to that.
At the height of the pandemic, the Masterton Hospital was swamped. Nurses and doctors contracted the disease, and volunteer helpers were called for. Special makeshift hospitals were opened in halls and clubs. All schools were closed for the summer break, and most businesses were instructed to remain shut. Eileen Cragg remembers what Masterton was like.
Masterton was badly struck, and you couldn't buy a lemon or get a doctor. And people didn't visit, they were all ill or too scared. I think I had it least of all. The whole family had it. It was a most dreadful epidemic, not being able to even buy a lemon or, just not, and nobody in the street, you didn't go out. Everybody was down with this dreadful flu.
Infections peaked about the 22nd of November, and fewer cases were reported in December. By the end of that month, the pandemic was effectively over in Wairarapa. 400 people had died, including 177 soldiers at Featherston Camp. Māori suffered a death rate 4 times higher than Pākehā. Naki Savage recalled helping whānau after her father died.
He was working up in Dannevirke at the time, and he died, and then my grandmother, well, his foster mother, she got the flu, but she really died of a broken heart, they told me, because I was only 7. And they told me, because she fretted so much for him. And she couldn't go to his funeral or anything, you see.
Most deaths resulted from bacterial infections of the lungs. As antibiotics were unknown, there was no effective treatment. Patients were urged to remain in bed and to take lots of fluids. Drugs, including the relatively newly discovered aspirin, were prescribed to reduce fever. Many patients' skin became dark as the infection progressed, a sign that their lungs were receiving insufficient oxygen. This cyanosis led to one of the common names for the pandemic, Black Plague.